Assalamualaikum and hi, my name is Haris Murshidi bin Maisa.
Hi, my name is Muhammad Amir Syazwan bin Tugiman and our supervisor is Dr. Nor Diyana Md Sin.
Alright, so our first objective is we want to measure the patient heart rates and body temperature for contactless checkup by using Arduino R3 as a microcontroller. So the second one is we want to implement and design a robot by using an infrared sensor.
So our third objective is to control the robot movement using the tape line to maintain the social distancing. And the last one is to develop a prototype that are able to help reduce the rate of COVID-19 infection by maintaining the social distancing in health units.
As everyone knows, from March 2020, the World Health Organization (WHO) categorized the COVID-19 situation as a pandemic, and now after almost 2 years we're dealing with it, there's no sign that it will end and disappear. Through newspaper Sinar Harian in September 2021, Datuk Seri Ismail Sabir Yaakob issued a statement calling on the people and the entire Malaysia family, keluarga Malaysia, to be ready to live with COVID-19 in the endemic phase transition at the end of October 2021.
The project aims to reduce the risk of COVID-19 contamination based on existing situational conditions. It is the safest way to minimize the spread of coronavirus disease started in 2019 by limit the close face-to-face contact with others, patients COVID-19 as well as normal patients. The frontline staff must wear PPE suits where it is made from plastic, which is costly because must change into a new case each time they visit the patients. The problem statement. So the first one, the COVID-19 cases increasing that able people or medical assistants need to applying the SOP such as social distancing. The second one is the doctor needs to interact with patients directly that can cause in increasing cases of COVID-19. The third one is the negative effect of using PPE where it is made from plastic, which is cause the growing in plastic pollutions. The last one is there are insufficient hospital staff in order to manage and control the COVID-19 patients as well as normal patients.
The ideas of this robot is come from a few ideas that we combine it together. So like we can see in this slide that the inspired project we use is automated moving robot by using tape line and also on a smartwatch application. And from these two projects we combine it together and become a smart medical assistant robot. So how the robot works? So the robot works in two situations where it is moved automatically using the input from infrared sensor and serve a medical assistant with the presence of temperature and pulse sensor on the robot. So the infrared sensor, there is two main components that differentiate dark and light lines, namely transmitter and a receiver. The transmitter will emit infrared light and the receiver will receive the reflection. In this project, we are using 6 infrared sensors that allow the project to turn 90 degrees. The number of this sensor is not tight, but it can increase or decrease depending on the situation. The next thing that moves this robot is of course the DC motor along with the driver. The DC motor is connected with the driver L298N motor driver module. These motor driver are sufficient to place 4 DC motor that we are used in this project. With this motor driver module, the rotational and the movement of this DC motor as well as the speed of the DC motor can be controlled by the programming.
The second situation is pulse and temperature works. The temperature sensor used is DS18B20 where it works to rate the body temperature of the patients by holding the temperature sensor on the hand or the armpit. Afterwards, the microcontroller will perform data calculations to calculate data retrieved from the patient and will be displayed on the I2C LCD display and also on the device. The pulse sensor works by shining a green light about 550 nanometer on the finger and measuring the amount of reflected light using a photosensor. This method of pulse detection through light is called photophotismogram. The microcontroller perform data calculations and determine data on the I2C LCD as well as device. The last one is the IoT works by using Wi-Fi module ESP01, where the Wi-Fi module needs to connect it with the Wi-Fi to functions the IoT ThinkSpeak, where all the data can be transferred to IoT ThinkSpeak by using Wi-Fi module ESP01.
Like we can see, this is a block diagram of this project. We separate these two projects, which is line following robot and also temperature and pulse sensor. The input data is come from the infrared sensor and the output comes to the motor driver and also the DC motor. And for temperature and pulse sensor, the input that we're using is temperature sensor and also pulse sensor, and the output comes to the LCD display and also Node MCU ESP8266, which is we are using ESP01. So this module will send the data to the IoT Internet of Things to the ThinkSpeak.
So this is our schematic circuit diagram, where the circuit diagram is the initial design of this project to make sure there are no mistaken during the hardware installation.
And next is future planning, that we are planned to commercialize this product. So the cost of this project is RM220. So we are planned to market this robot in the range price RM250, which is acceptable based on the hardware. In general, that we can see in the market price now for this infrared robot, the range market price is in the range RM300 to RM500. And the good advantage of this product is we have the medical assistant, which is the temperature and pulse sensor that have in smartwatch application. As we can see, this type of line following robot is not new in our world. There are many industries that already use this type of line following robot in the industry.
Okay, this is our commercialized planning. The packaging box we use is in rectangular shape, where it can fit our medical assistant robot. The theme we are used is yellow and black in order to match it with our robot.
So next, for the safety of the product. So the first thing is we are using the safe material, which is the body of the project. We are using acrylic chassis, which is not harmful to people. So the second one is low voltage system, which is we are using 12 volt system, and we are using the Arduino R3 as a microcontroller that able to regulate the supply system. So in this project, we are using lithium-ion battery 18650 battery, which is this lithium-ion is more safe than the others battery.
The product comparison. There are two models of line following robot as our project, but as you can see, the robot only use 3 IR sensor, where our robot use 6 IR sensor that allows to turn 90 degrees and also more accurate. The second one is they are used only 2 motors or tires compared with our robot that using 4 motors, where it is more stable. Next, our robot have the additional functions where it is temperature and pulse rate sensor compared to these 2 robots where it is only line following functions. Last but not least, the capacity of the battery of our project is in large value, where we are using 7 lithium-ion 18650 battery, where it is rechargeable battery. On our future upgrade, we will increase the battery capacity so that the robot can last long. Next, we will add the charging module in order to ease to charge the robot and no need to open and reinstall after full charge. The robot will be waterproof. And last one, it will has more space or compartment to put goods as well as medicine. So in the future outlook, our robot will look like this, where has arm like human that can holding something such as medicine. In conclusion, this robot is reliable and relevant in this pandemic COVID-19 era as well as in the long term. It is less complex of the component used that can reduce the maintenance. And the last one is, this robot is produced with a reasonable costing and it is easy to operate in hospital and also clinic.
As we can see, the robot was received the input from the infrared sensor. The infrared sensor differentiate dark and light lines, namely the transmitter and also the receiver.
So this is the second part of this project, which is cover the temperature sensor and also pulse rate sensor. As you can see, I put the temperature sensor on my arm other than the armpit, and then put the finger on the pulse rate sensor. The pulse rate sensor will shining the green light on the finger and measure the data from the reflected light by using the photo sensor. The output will come out like this, which is the normal BPM is from 60 to 100 BPM, and this output for temperature. And then the temperature and pulse rate data will transfer to the IoT ThinkSpeak, where it is the application that we are use.